Hello.
That's very good. To improve the quality of life and further to prevent further complications. It's very good. We have to improve the quality of life of the patients. Like a normal patient, that it's their right to be improve their quality of life. So we will see the principles of caring for a bedridden patient. First one is prevent health complications.
Uh, there's one more thing, that's when we are giving the basic nursing care or the regular care, we understand the changes in the condition of the patient. So we can regularly monitor what is the, I mean, we can detect the changes in the patient condition, and we can provide and facilitate the timely interventions. Along with that, provide the patient satisfaction. One of the contribution here is we can provide the holistic care, depends on the what is the condition of the patient, mental, physical, social, and spiritual. So that's why the basic nursing care is quite important.
Yeah, yes, absolutely right. We will monitor the means we will monitor the patient condition. So next, coming to the principles in caring for a bedridden patient, first one is as someone said, is prevent health complications. Next one is to promote comfort. It's all the people. If it is a bedridden patient or if it is a normal patient, if it's a normal human being, we all want a comfort zone. We want to be a comfort. We want to be a well-being. So we have to promote comfort to the patient. Next is build confidence. Why it's important to build confidence to the patient?
Somebody please respond.
In Patients Corporation.
Can you please repeat the question?
Why it's important to build confidence between to the patient?
Because it really empowers the patients. Once we build the confidence and we educate the patient, it helps them to get involved in the care, and so that we can set the goals, we can give the positive informants, we can enhance the system of care. So these are the benefits of improving the confidence in the patient.
Yes, absolutely. We have to maintain confidence with the patient so that we can give proper care to the patients and they will have a trust with us. So next one is prevent isolation. Uh, Maybe this is aware that almost all the bedridden patients or whatever the patients in home, they feel isolated, they feel neglected sometimes. They have some psychological issues with them. Sometimes there may be lack of caregiver. There may be there is no proper care to them. So they will feel that they are isolated from the family. They are isolated from the society. So it will help us to prevent isolation. As early someone said, next is improve quality of life. We can give a quality of life for the patients. Next one is what are the basic needs of the patients? Uh, can someone tell what are the basic needs for a bedridden patients? What are aspects we have to give proper care to the patient? Yes, personal hygiene.
Hygiene, nutrition, hydration, elimination, comfort. Then uh, some physical and cognitive exercises.
Yes, okay.
Mm, Environmental needs can be related to comfort of the patient, providing the facilities of the patient, providing privacy to the patient. These are the environmental needs. And if you talk about the communication, companionship, support, this all are the emotional needs of the patient. So there are
Oh,
lot many needs.
okay. So, as a, mainly the personal hygiene. It's coming under oral care, skin care, eye care, ear and nose care, hair care, perineal care, and nail care. Okay. So we will see each one in detail. First one is oral care. So, is it important to give oral care to the bedridden patients? Why? Or as we see, that's the oral care is the overall health. We study that our mouth is the pool of microorganisms. Is it? Yes. So, what is the purpose of oral care is mouth is an excellent incubator of growth of bacteria. So, our hygienic practices help to maintain healthy status of the mouth, teeth, gums, and lips. Why it's said that it's the pool of microorganisms?
See, first and foremost thing is that mouth has a neutral pH.
Yeah.
Um, that is a reason it can accumulate lot many bacteria.
Okay.
Second thing is it's moist, it's moistured always, and I mean it contains all kind of anaerobic bacteria like lack of oxygen is there. There's spaces between the teeth and gums, so food can accumulate there, and it can help bacteria to flourish.
Yes.
That's why.
Okay, it's very good answer. So we have to keep a good oral hygiene. To what else we have to do is remove food particles that may be likely medium for bacterial growth. Next is to keep the lips and mucosa soft, clean, intact, and moist. Next is promote comfort, improving nutritional status by enhancing appetite, stimulate the blood circulation of gums, thus maintaining healthy firmness. So eliminates the source of unpleasant odor, prevent dental caries. How many of you have dental caries?
All of us.
All of us have. Okay. So what may be the common oral problems?
Gingivitis, cavities. What else? I mean, you're talking for the patients who are on palliative care or for the normal?
Normal and for the palliative care.
One is gingivitis, one is thrush, one is ulcers, one is swelled gums. I mean, bleeding from the gums. These are common problems.
Yes.
Gingivitis.
Gingivitis, that is one of the
Stomatitis.
commonest one.
Okay, fine. So we will see the common oral problems. First one is dry mouth or painful mouth. Second one is halitosis. Third one is candidiasis. Next is oral mucositis. Next is alteration in taste. Is alteration is in taste is only for the bedridden patients?
No, for common too.
For the common people also, we will have, when we have fever also, we will have alteration in taste, is it? So why the cause of dry mouth in bedridden patients? Okay, dehydration.
Because of medications?
Yeah, yes. Because of the medication, some of the drugs will cause dry mouth. What is the meaning of halitosis?
Bad odor?
Yeah, bad odor. So, and candidiasis is
Gangrene formation?
the fungal infection.
Yeah.
Fungal infection.
Okay. So next one is the excessive salivation. Xerostomia. What do you mean by xerostomia?
Hello.
The secretions from salivary glands. That's the
Hello.
Hello.
Sachin.
Am I audible? Somebody please respond. Is our voice is audible or not?
Yes, it is audible.
Yeah.
Audible.
Okay, xerostomia is dry mouth. Next one is candidiasis, is the fungal infection of the mouth. Okay. Next one is halitosis. Some of us may be experienced with this. Is it? Some of us also we have. Okay. The next one is mucositis. So who needs mouth care? Who needs mouth care? So we will see who all needs mouth care. This is terminally ill patients, and next is unconscious patients. Next, patients breathing through mouth. Post-operative patients. Next, patients with infections and disease of mouth. Patients on NG2 feeding. Is it right? Is it clear who needs mouth care? As terminally ill patients, unconscious patients, patients breathing through mouth, postoperative patients, patients with infections and disease of mouth, patients on NG2 feeding. So next is the assessment part. What are the things we will assess? Cracked lips, dry or clotted tongue, white curd-like patches, ulcers in the mouth, any redness or bleeding, any pain in the mouth, dysphagia or change in taste of food, any difficulty in chewing, anorexia, unpleasant smell, medication history. Okay. And next is the treatment history. This is the general assessment of a patient for the bedridden patients. What are the things we will look for the patient? What is the reason for the pose? White card-like patches indicates white card-like patches indicates it's candidiasis, fungal infection. Yes. So these are the assessment we have to do. Next part is solutions used for mouth care. So you can contribute your points. What are the solutions used for mouth care?
Chlorhexidine.
Yes, you. So we are using water or 0.9% sodium chloride. Okay, this is the normal saline, sodium chloride or homemade saline. How we will make homemade saline is other options is soda bicarb also we are using for the mouth care. Homemade saline is using preparing saline solution is 500 ml of water. We are adding 1 teaspoon of common salt. So 500 ml of in boiling water, we are adding 1 teaspoon of salt and we are making it cool and keep covered until it's needed. Okay. Other option is soda bicarb. Is that clear? So how we will make soda bicarb solution? In 500 ml of water, we are adding 1/4 teaspoon of baking soda. So what are the educations we will give to the patient or the caregiver? What are the things we are doing for care? For us, what are the things we are doing? We are not doing anything for the oral care. Then how I will give instructions to the patients, is it? What are things we are doing for the oral care? So we are doing brushing, is it? So we are brush the teeth twice a day with a soft toothbrush. Toothpaste left in the mouth can cause dryness. Okay, the chemicals in the toothpaste also cause dryness. So rinse the mouth properly with homemade saline or soda bicarb solution. Tongue to be brushed with soft toothbrush. Take plenty of fluids. Pineapple contains a mouth cleansing enzyme, also a salivary stimulant. However, it is acidic. So it is helpful to clean the mouth. So what are the self-care educations we are giving? Brush the teeth twice. Rinse the mouth properly. Tongue to be brushed with soft toothbrush. Take plenty of fluids. Danger should be removed at night. So procedure for a patient requiring assistance. Now we are giving, normally we know how we are giving oral care to the patient. Like this picture, we are providing oral care to the patients. First one, we have to, for each and every procedure, we have to explain the procedure to the patients. Next one, provide privacy to the patient. Next, provide semi-powerless positions or powerless position if not contraindicated. Place a towel under his chin and over the bedding. Pour the water over the brush. Place dentifrices on it. Encourage the patient to rinse his mouth frequently. Remove and clean the equipment. Wash your hands. Document time, solution, needed condition of the oral cavity. Is it clear? For the normal patient, we are doing this kind. like this we are giving oral care. So next to the procedure for a terminally ill patient, what are articles needed in hospital settings? In hospital settings, we need an artery forceps, a tongue depressor, and next is in home care settings, we need a spoon or ice cream sticks, clean cotton cloth or a gauze piece, homemade saline, plastic sheet, face towel, clean water, soap sticks. These are the articles we needed for the oral care. In hospital settings, we need a artery forceps, tongue depressor, gauze piece, normal saline, small Macintosh, face towel, clean water, soap sticks, and kidney tray. And in home care settings, we won't have an artery forceps, so we'll use spoon or ice cream sticks, clean cotton cloth or gauze piece, homemade saline, plastic sheet, face towel, clean water, soap sticks, and kidney tray. So procedure for a terminally ill patient, we have to explain the procedure to the patient, provide privacy, place a small Macintosh with a face towel under the head, semi-Fowler's position and her turn towards the side. Use a padded tongue blade to open the patient mouth and separate the upper and lower teeth. Soak cotton balls in the homemade saline and squeeze out excess water. Clean teeth. Lower chewing surface, inner side and outer side. But I hope you all know how to brush the teeth. Is it? So clean teeth from lower chewing surface, inner side and outer side. Upper chewing surface, inner side and outer side. Clean oral cavity from proximal to distal using one gauze piece for each stroke. Clean with normal water. Lubricate lips using swab stick. Document time, solution used, condition of the oral cavity, any abnormalities noticed, and the patient's response. Is that okay? So what are the common lubricants we are using is liquid paraffin, coconut oil, ghee oil, and Vaseline.
Do everyone anybody have any questions? If you don't have any questions, we can move on to the next part.
So next is the care of eyes. So we have to care the eyes of the bedridden patients. So what we can do is, first thing is we have to explain the procedure to the patient, what we are going to do. So next is provide comfortable positions. Next, wash hands. Is clean the eyelids and eyelashes with wet soaps. Wipe the lids from the inner canthus to the outer canthus. Use one swab for one stroke. And we have to document the procedure. So what we have to do is, for each stroke, we have to use each swab. One swab we have to use for the one stroke. And from inner canthus to outer canthus, we have to clean the eyes. Next one is care of nose and ear. So in this also we have to explain the procedure to the patient. To remove the secretions from the nostrils, wet wash clothes or a cotton applicator moistened with a normal saline or water. So we are using normal saline or a water to moisten the applicator, cotton applicator, and we will remove the secretions from the nostrils. Check for any dirt accumulated behind the ears and in front part of the ear. Collection of wax in the ear may cause hearing problems, as we all know that if we also have accumulation in the accumulation of wax in the ear, we have also hearing problems. So we have to take care of the nose and ear. Next one is care of hair. I hope all the people are done hair wash while we are studying. Is it? So how we will care hair is, first one is explain the procedure to the patient. Next one is help the patient to move his or her towards the edge of the bed and remove the pillow. Next, protect the bed linen and pillow cover with a towel and mackintosh. Insert a cotton balls into the ears to prevent the entry of water to the ears. Place a mackintosh under the patient's head and neck. Keep one end of mackintosh in a bucket to receive the water. Next, wash thoroughly with soap or shampoo. Rinse thoroughly and dry the hair. Braid the hair into two on each side of the head. Remove the cotton balls from the ear. So, is that clear? So, next one is nail care. In this also, we have to explain the procedure to the patient. We have to arrange the articles. Place the rubber sheet under the patient's hand or leg. Soak the fingers in warm water for 5 minutes. Next, we have to cut the free edges of the nails. Encourage the caregiver to provide nail care. Next one is bed bath. Bathing is very important in maintaining and promoting hygiene. What are the objectives of bed bath? Is to clean the dirt from the body, to increase elimination of waste through the skin, to stimulate circulation, to induce sleep, to provide comfort, to give the patient a sense of well-being, to regulate body temperature. Is it okay? So, procedure is, we have to maintain privacy to the patient, explains what we are going to do, arrange all the articles. Next, the temperature of the water should be checked and adjusted for the comfort of the patient. Keep the patient near the edge of the bed to avoid overreaching and straining of the back of the caregiver. Only small area of the body should be exposed and bathed at the time. Remove the soap completely from the body to avoid the drying effect. Cleansing is done from the cleanest area to the less clean area. Example, upper part of the body should be cleaned before the lower parts. So we have to see, we know which body part is more contaminated, which body part is less contaminated. From the upper side, we have less contamination. So we have to clean the upper parts of the body first. Next, the lower parts of the body. Next, wash hands and feet by immersing them in a basin of water, because it promotes through cleaning of the fingernails and toenails. We have to take care of the nails also. We seen that we have to clean the nails. So we have to immerse the hands and feet in the basin of water. A thorough inspection of the skin, especially at the back of the body, should be done to find out the early signs of pressure sore. Next is applying moisturizing cream and massaging at least 3 to 5 minutes. So how we will give back care? As it said earlier mentioned, we have to prevent bed sores, so we have to give back care. So give special attention to the pressure points back every 2 hours. Lather soap by sponge towel. Wipe with soap and rinse the plain warm water. Dry the area by patting and not by rubbing. Apply moisturizing cream and massage at least 3 to 5 minutes. Massaging helps to increase the blood supply to the area and prevent pressure sore. Next one is active and passive exercise. As a normal human being, we can move around. For the bedridden patient, we have to do the active and passive exercises. So exercise must be integrated into the patient's daily life, as it prevents contractions, foot drop and wrist drop. All the joints need physiotherapy. Educate the family the importance of exercise to prevent joint stiffness. So when we are visiting the patient, some of the patient may have caregiver, some of them won't have. So after after 1 month, the patient's joints may become stiff. When asking to them, they will say that we don't have enough time to take care of the patient. So it is important to give physiotherapy to the patient, especially to the joints. We have to educate the caregiver to give passive, active and passive exercise to the patients. Next one is catheterization. So for the bedridden patients, they are unable to go to the toilet. So we are doing the catheterization. So catheterization is that Foley catheter is a sterile tube that is inserted through your urethra and into the bladder to drain urine. So you can see in the picture, these are parts of the catheter. I think all of you are familiar with this. So type of catheterization is indwelling catheterization, indwelling suprapubic catheterization, clean intermittent self-catheterization, and condom catheterization. So this is the indwelling catheterization. And also you can see that suprapubic catheterization also. So next, coming to the catheterization for procedure, it's a sterile procedure. Take all sterile precautions. Choose the smallest size possible. So lubricate generously and wait. It is important to ensure that the bulb is in the bladder. How much to inflate? So can you contribute your point? How much we have to inflate during catheterization?
So 10 ml
10
saline,
ml saline,
20 ml.
20 ml.
Any other answers? $20.
According to the size, the inflation is different.
Yeah, in the Foley's catheter, they will be mentioning at 30 to 50 ml. So you can see that capacity. So from the catheter itself, you can see that capacity of the bulb, but just we are asking about how much you take for inflating the bulb. Sonam said 10 to 20 ml. Okay. Thank
Okay.
you.
It's 10 ml. Mainly we are inflating 10 to 15 ml. That's too much can cause bladder spasms.
So one important thing, 10 to 15 ml is enough. So you always take that sterile water for inflating the bulb. So if you take more than 10 ml, so when you take 10 ml and try to inflate that bulb, so it's like an amla size. So okay, so our aim is to keep the catheter into the bladder. That's why we inflate the bulb, right? So if you inflate more than 20 ml, more than 15 ml, what happens? The bulb size will increase. That bulb will touch the bladder trigger, that bladder trigon, and so that leads to the patients that develop bladder spasm. Okay, so if the patients, if while we inflate the bulb, the patients develop bladder spasm, what you can do is you have to deflate the bulb and wait for another 2 minutes so that all that bladder spasm will subside. After that, you can just inflate slowly. So This is very, very important. If you take more than, so the catheter, they have mentioned about the capacity of the bulb. So that much capacity, that bulb is, that much water that bulb is able to. So that is the capacity of the bulb, not about the inflation. So that you have to keep it in mind. Okay, usually when we inflate, I have seen many patients when we inflate the bulb, they develop bladder spasm, but we don't know how they develop bladder spasm. So you have to keep it in mind all the time. Okay, thank you.
So too much can cause bladder spasm, as ma'am said. Next is antibiotic prophylaxis for urinary catheterization is not recommended. So for clean intermittent catheterization, so what we have to do is maintain privacy to the patient, wash hands, position according to the comfort level of the patient, Nelcat size 12 trench, lubricate the tip before insertion, time interval we have to teach is every 4 hours, clean the Nelcat under running water and keep it in a dry clean container. We have to teach the patients about this clean intermittent catheterization after the patient is having bladder sensation. So what is this? What is it is maintain we have privacy to the patient, wash hands. So we can inform the patient according to the comfort of the patient. They can have the position, and then we have to insert the nail cap. Before insertion, we have to lubricate the nail cap. Every 4th hour, we have instruct the patient to drain the urine. So after that, it is important to teach the patient how to clean the nail cap and how to keep it. Inform the patient to clean the nail cap under a running water and keep it dry and keep it in a clean container. So what are the advantage of this is improve the quality of life, increase self-esteem and confidence, easy to use, inexpensive, reduce the risk of infection and improve sexual life. So next one is the condom catheterization. The advantages and disadvantages is less catheter associated urinary tract infection, more comfortable than indwelling catheter, less movement restriction, non-invasive. So the disadvantage is leak if you are using the wrong size and the fit is incorrect, skin irritation and breakdown from urine leakage, more likely to fall off or leak than internal catheters, allergic reactions from the latex. Okay. Next is a case scenario.
Can anyone please read this patient scenario? Anybody? Anybody please read?
The home care unit of the hospital made a visit and found that the patient was having pericatheter leak. So they changed the catheter. The next day, the carer noticed that the pericatheter leak was still persisting. She called them again. They came and changed the catheter. Again, the next day, the same happened and was again. The catheter was changed. The catheter was changed 3 times, but the problem did not resolve.
So what could be the problem? So please put your answers in the chat box.
1 o'clock. We were going and then after 1 o'clock. So, एक ही घर के दो तो बाहर.
The balloon has been deflated. Okay. Any other answers? Different size, Pratibha said. Okay. Do you mean that we need to increase the size of the catheter? So, Sister Veronica said no proper size. Maybe again, I assume that you are going to increase the size of the catheter, right? Because of the catheter leak. Okay. Any other answers? So here, what you have to understand is if someone called you and said like a pericatheter leak, you have to identify the cause first, because the other that causes is also can develop, that leads to the patients can develop pericatheter leak. Okay, so the first important thing is constipation. Constipation is one of the most important problem here. So if there is a chronic constipation there, that the neck of the bladder will be obstructed with the fecal matter, so that the urine won't be able to come out freely. So the pericatheter leak will be there. And the second cause is urinary tract infection. If the patient is having urinary tract infection, again the patients can develop pericatheter leak. And the third cause is overinflation of the bulb. Again, that if you inflate the bulb over, what happen? The bladder, the bulb will touch the bladder mucosa. Again, that bladder is stimulated, and that leads to pericatheter leak. So instead of changing the size of the catheter, you have to think about the other cause. Is there any correctable cause is there? If there is a constipation there, you have to give a the constipation management. You have to give an enema or put a suppository and relieve the constipation, so that that urine will move freely. So these kind of things. And if the patient is complaining of urinary tract infection, then you have to check the signs and symptoms of urinary tract infection. Usually they'll say like a cloud, that urine color is pus color and cloud form. So they might be thinking like, oh, urinary tract infections. You have to check whether there is any signs and symptoms of urinary tract infection. Then only you have to give think about the medication of urinary tract infections, antibiotics. So if they don't have any the signs and symptoms of UTI, then you can leave it, and then you can think about the overinflation. So these are the some important points you have to keep it in mind, and also thinking that urine catheter. So, again, there is a chance of urine catheter leakage. So these are other minor causes, but these are the three major causes of pericatheter leak. Thank you.
So next we are moving to the bladder care. So we have to change the catheter 3 weeks to in 1 month. Next we have to provide perineal care. Keep the urobag cap always closed and below the waist level. Empty bag when it is 3/4 full. Intake of fluid at least 2.5 to 3 liters in 24 hours. Observe urine is draining freely. Any color change in the urine should be reported. Encourage the patient for daily bowel movement. So next, how we are doing care of perineum. So perineum should be cleaned after each act of urination and defecation to prevent the infections. So clean with soap and water daily 3 to 4 times and keep the area dry. Clean from the cleanest to the less clean area. Hands should be cleaned after giving perineal care. So next one is the bowel care. In a bedridden patient, due to lack of exercise, privacy, reduced food intake, medications, etc., cause constipation. Encourage the patient for bowel movement daily. Give time for the bowel movement. Patient should be encouraged to take high fiber diet, adequate fluid intake. Encourage regular exercises. Next is use of bedpans. It is mandatory to maintain patient's privacy and use a commode or lavatory for defecation. Is spurious diarrhea? Is anyone can say what do you mean by spurious diarrhea?
Anybody? So from the gastrointestinal symptoms, second part you have learned about a spurious diarrhea or overflow diarrhea. What is that? Anybody?
Pain past the heart streets. Okay. Confusion is constantly water streets leads up. Okay. Okay, spurious diarrhea is present. Ask the history when it started and before the onset, what was the condition. What are the management is for rectal examination, manual removal or high sodium phosphate enema. So these are the things we are doing in a bowel care. So for in spurious diarrhea, we are managing we are doing a rectal examination. If it is possible, we will do it manually. Otherwise, we will give a higher enema. Next, we will go into a video.
Okay. Thank you. I hope this video is clear to everyone. So we can move on to the next part.
So we'll move on to the next part. That's nasogastric tube feeding. It's an artificial feeding for the patient who is unable to take food orally. So this is a process of feeding with the tube inserted through the nose, pharynx, esophagus, and into the stomach.
Kindly wait for a minute.
So care of nasogastric tube is perform hand hygiene, give porous or semi-porous position before feeding, prevent air entry in the tube by pinching it, aspirate and make sure that the tube is in the stomach. If more than 50 ml, skip the feed. Food items is thoroughly grinded and filtered. If not, the big particles of food will obstruct the tube. Every 2 hourly give 200 to 250 ml homemade. About 25 ml of plain water is given before and after the feed. keep the patient in same position at least 30 minutes, provide oral care and keep the lips moist, change the adhesive periodically to prevent ulcer formation. So I think all of you knows how to give tube feeding to the patients. So why we are giving Fowler's or semi-Fowler's positions before feeding? To prevent regurgitation.
Please unmute yourself and give reply to the faculty.
Okay.
Thank you. So one of the major complication of nasogastric tube feeding for a med-bound patient is aspiration pneumonia. So what is the cause of that? Why the nasogastric tube feeding patients develop aspiration pneumonia? What is the problem? When we insert an nasogastric tube, what is happening? What is the changes happening in our anatomy? In our gastrointestinal system, what is the changes is happening there? Nothing changed. So what happened? So when we insert a nasogastric tube, so just imagine you are going to put a nasogastric tube to the patient, right? So when we insert a nasogastric tube, yeah, so the Sister Veronica said the sphincter remains open. The gastroesophageal sphincter will be open all the time. That because the sphincter is there, but inside the sphincter there is a tube. So the sphincter is not able to close fully. So that after feeding, the patients might have regurgitated, and that food goes to the trachea and that leads to aspiration. So always you have to keep the patient semi-Fowler's position or little bit high before feeding. And after feeding also you have to keep that same position at least half an hour. So that immediate after feeding, after feeding immediately the patients might have regurgitated. So have to keep the semi-Fowler's position before feeding, and after feeding also you have to keep the same position at least for 30 minutes. So that is why that semi-Fowler's position is recommended for nasogastric tube feeding. This patient is on nasogastric tube feeding. If the patient is asking, I want to eat sweet dishes or biryani, something like that, will you give?
Is it audible? Veronica, are we audible?
Not so clear.
Not so clear. What about now?
Yeah, okay, fine.
Okay. So just I was asking a question. If a patient is on nasogastric tube feeding, if they are asking about a sweet dish or a biryani or something like that, will you give? How will you respond? Please respond. So we used to hear these questions often because usually the patients who are is having nasogastric tube, they will be asking like this. Answers, please. Anybody? From this silence, I assume that nobody's.
We can give 1 spoon, like just to taste. Otherwise, we have to grind in the mixie and put in the tube and give.
Okay, thank you. So, as Sister Veronica said, just take the dishes and show them, and if they want, you can give a small portion of to taste it, and after that, please mute.
Self-convenience.
So what you can do is you can make dish and show the patient, show to the patient, and so when we that maybe when we are seeing that food from that color and that all, they we feel some sort of satisfaction, right? When we cook also we feel some sort of satisfaction, right? So the same feeling will be there in the patient side also. You can show them, and if they want, you can give a portion of that to taste it. If they want, they can that swallow it. Otherwise, they can spit it out. And after that, you can grind it that part. You just tell them, I am going to grind it and give it to you through nasogastric route. So just give a satisfaction. Just if they want, if they ask you to taste these kind of things, just make these kind of things and show them, and then you can, if you want, they want, you can give a portion of portion of that things to taste it, and then you can give through nasogastric tube. So this is how we used to manage the nasogastric patients here. Okay. So. So again, we have one more video. As always, you have to please. Always you have to think about that this nasogastric tube is in the stomach. There is no sphincter is there to control the food. The semi-fowler's position, the importance of semi-fowler's position before and after feeding. So that is very, very important. The caregiver doesn't know the importance of keeping this semi-fowler's position. If you tell them that for the complication, then they will realize that importance of the positioning, and they always use this position for feeding and after feeding. Always you have to educate the patient to prevent air entry, and that 50 ml at that time you can take it to 200 ml feed. It's not more than that because we need 50 ml for that giving first and after that also 25 and 25. So total 250 ml is enough for one time feed. And as I mentioned earlier, you have to keep that same position for at least 30 minutes so that we can prevent aspiration. Provide oral care. So if the patient is on nasogastric tube feed, the oral part is often neglect because they might be thinking like the caregiver might be thinking like he or she is not taking anything through mouth. Then why we can provide why the what is the purpose of giving oral care? So that is also important. They have to keep the oral mucosa clean, and usually this kind of patients can develop dry mouth. So that every second hourly oral care is mandatory here. And change the adhesive tape. That is also important because if you are not give the change the adhesive tape, that leads to ulceration. So that is also you have to keep fix the nasogastric tube either the right side of the cheek or the left side of the cheek. No need to that on the bridge of the on nose all the time. So these are the important points you have to keep it in mind. Always they have to wash their hands before preparing the feed, because that if they have maintained an unhygienic practice, that leads to the patients and develop diarrhea. So that is also very, very important. I'll show that video. Thank you. Anybody have any doubts? So we'll show that video later. Anybody have any doubts? Hope my audio is clear to everyone. Somebody please confirm.
Can I ask a question?
Yes, Rajitha.
It's regarding checking the placement of the tube. Do we
Yes.
still follow the this one like syringe, wherein we push the air and check
No,
for
we
any
used
sound?
to aspirate. We used to aspirate through the
Yeah,
syringe,
the
aspirate
three
the
techniques.
gastric
Yeah.
contents, and make sure
Do
that
we,
the stomach, yeah.
do we do the litmus paper as well?
We are not using that kind of things. You are do you use in your settings?
Yes. But
Yeah.
when I did my training in CMC Velo, we used to do this first the aspiration, then you do
Acidity
this.
test, right?
Yeah.
Yeah.
But in the UK, we are not allowed to, push air and what the ones that we did with the stethoscope checking.
Yeah. So
And
how will
we used
you
to,
check? How will you use that? Because if you have a litmus paper, we need to gastric contents for
yeah,
checking
little bit they take
little
out.
bit.
Sometimes what happens, sometimes the stomach is completely empty. So at that time, sometimes we are allowed to make the patient drink orange juice, little
Okay.
bit. And then we aspirate a little bit and check the litmus paper.
Okay.
Otherwise, we have something called the ones that we use here, the Riles tube. There's a really large diameter, is not used for feeding at all. The ones that they use is very fine and thin. It's got numbers. So after they confirm the placement through the X-ray, then that particular number is recorded to the patient's file. And every time somebody is handling the tube, either for anything, any purpose, especially for feeding, we have to mention at what level the tube is. And then we do the litmus test, acid test.
Yeah. So here we are not practicing that. We
Okay.
used to aspirate the gastric contents. And for inserting, if you insert initially the first time, we used to check that the gastric contents first, and then we used to push a little bit air into the stomach, and we can hear that sound with the help of a stethoscope. But before feeding, we used to not every feeding we push air, but for the first confirmation, we used to push air and hear the sound. But after that, we used to aspirate the gastric contents.
Yes. Okay, thank you.
Okay, thank you. Thank you for asking that question. So I am going to show that video again. Anyway, let me check whether that video is moving or not.
Let's see. Position the patient in.
Sorry, that is not the right video. Anyway, we can leave that. Maybe later I'll show that video. Sorry. Any questions? Anyway, we have discussed about that. How can we educate the patient about nasogastric tube feeding and all? So what are the points you have to keep it in mind for giving nasogastric tube? That is very, very important. We all nurses, we all know that how to give feeding, how to give a catheter care, how to give a nail care, how to give a hair care. These all things we all know that, but the caregiver doesn't know. So that is why we have to educate the caregivers. This is important. You have to encourage the caregivers because they don't know. They are not they are not nurses. They don't know how to take care of a bedbound patient. So this is very, very important. You have to educate them and encourage them and demonstrate them and ask them to re-demonstrate it back so that we can able to correct it. And so these all things very, very important, especially bed making. Even bed making also, they don't know how to change a bed sheet for a bedbound patients, how to give put a new bed sheets to for a bedbound patients. What they usually do, they pull the sheets under the patients. So that leads to the patients can develop pressure also. This is very, very important. We have to demonstrate them before leaving the hospital. It's our duty to educate them and demonstrate them so that they can able to get a good confidence level to take care for patients. Okay. So time up. We can wind up the session. Thank you. I hope there is no questions. Is Nasima said, can you use diluted Conti solution for mouthwash? What is that? So we usually use normal saline or soda bicarb solution for mouth wash. But there are washes are available. If you use continuously, that leads to the patients can develop mouth ulcers. For a short period of time, you can use any mouth solutions, but mouthwashes. But if you use long term, that again that can cause oral ulcers. So that also you have to keep it in mind. We don't use here. We are not using potassium permanganate. Here we used to use the normal saline and soda bicarb solution for mouth care. Okay. Thank you. We can wind up. So to you.
Okay, thank you, Sister Rajitha, for the wonderful session. I thank Sister Shiva for the facilitation she has done. I thank all of the participants for the attentive listening, and I expect more interaction from tomorrow onwards. I'm reminding also that we'll meet tomorrow. Thank you then. Thank you.
Thank you.